So in this video, I'm going to share with you a little bit of a reality check, mostly about modern health problems and the common sense things that you can start with today. So here's the reality check. Right now, in the modern world, 1 in 5 people has been diagnosed with an autoimmune condition. Autoimmune diseases are considered, for the most part, lifelong. Some aren't really that destructive to your health. Others can completely rearrange your life in a few months. In the next few years, it's very likely that modern medicine will start moving things like cardiovascular disease, cancer, Alzheimer's disease, and type 2 diabetes into the underlying umbrella of autoimmune conditions. And if that happens, that means that 1 in 2 people in the modern world will be diagnosed with and require treatment for an autoimmune disease. And that's terrifying as a person and as a doctor. Another reality check is that most of these diseases, especially the chronic and complex ones, are run by a kind of background chronic inflammation in the body and within your immune system. And unfortunately, most of the drugs that modern medicine has just block certain pathways, mostly to mask, hide, or diminish your symptoms. And that's a great thing to have in the sense of being comfortable or being in some control, but that's more like treating the what than the why. This is a hard reality check for some people to accept, but the chronic fatigue, distress, discomfort, disorientation, the chronic inflammation of most chronic diseases, again, mimic what it's like to have chronic trauma. Even if you have had the best life and the best family and the best childhood, if you have an autoimmune disease, there's a part of you on a somatic and psychological level that's dealing with chronic distress, which is almost the same as having trauma. I'm going to keep this short, so the last reality check is, yes, you are going to have to fundamentally change your lifestyle, your diet, your choices, how much you work or work out, how you rest, how you sleep, and how you play. So those are some common sense reality checks, I think. Let's talk about some opportunities. To the best of my knowledge and experience, what is called an autoimmune diet is the best choice that any of us have to controlling chronic inflammation. And it is the foundation of a healthy, adaptive, and functional immune system. Stress reduction practices like meditation, breath work, Qi Gong, yoga, they're ancient for a reason. They've been around to support people in their health and their lives for thousands of years for a reason. It's because they work. They've been passed on because they work. I've practiced these things many years in my life, and they've helped me probably more than anything else that I do. One of the coolest things I get to see and share with people is that when people become more committed and consistent and determined, they actually start to feel more confident. And when you think about it, if you look at a person playing a sport who's really confident, in that moment, which may be their first time ever that they've ever played that well, they're moving in a very consistent, committed, and determined way. So sometimes if you don't feel very confident, it's kind of like acting maybe a little bit. You just have to do what confident people do. And when it comes to becoming confident with your lifestyle, your diet, your supplements, your meditation, and whatever else you decide to include in your care, be determined, be consistent, be committed, be connected to people, share your experience, make it as meaningful as possible to you, and it will work even better. Another opportunity is to focus on the root cause, or the why. Again, in modern medicine, we're all in a hurry, and I don't blame Western medicine for how they work, and it's not that I blame anyone really. It's just been that for the last 50 or 60 years, the focus of our culture, the patients who have medical problems, and the doctors who take care of them have all been in a pretty big hurry. So it's more of a cultural reason that we have modern medicine who has a pill for everything instead of a protocol that's tried and true for thousands of years. So again, focus on the why, not the what. In functional medicine and in Chinese medicine, we always keep saying to people, we need to establish the root cause. And when you do, you're focused on the why. The last opportunity I want to share with you is to just share that it feels amazing to get your life and your health and your adaptability back. Chronic illness isn't like a light switch. It isn't like on or off. It's more like a spectrum or a scale. I've had times in my life where I was doing really well, and I've had times in my life where I was not doing very well at all. But I'm very aware in my own life and in my practice that if I'm consistent and determined, I stick with my protocols, I will gradually start to feel more and more momentum and more benefit, and of course less and less symptoms. So this is an opportunity for you to begin the journey of getting your life back. Again, my name is Dr. Michael Smith, and welcome to my new website, Integrative Health Detective. This is meant to be a resource for you to find what you need around diet and supplementation and an understanding of autoimmune disease, complex trauma, and addiction. Be well and have a meaningful day.